talk about today is the effect that stress has on your body. We've known for years and years and years that people that experience lots of stress, have high anxiety in their lives, have really deep depression, tend to die earlier. We know they have a higher incidence of heart disease, a higher incidence of a lot of cardiovascular problems, and we know that the worse the depression and the longer it lasts, the more likely you are to take decades off your life. What's new is that we now understand some of the specific mechanisms by which stress will kill you. What we understand now is that the longer we allow ourselves to exist ruminating on scary thoughts, on depression, on hopelessness, on negative self-talk, the more time we spend in a stress state, during that time there are toxins that appear in our blood that are actually killing us slowly, killing us softly for the length of time that we are entertaining negative emotion. Okay? That's what I'm going to talk about today. What are the specific toxic effects of stress? Here we go. We can now measure in your saliva a substance called interleukin-6. It's not a new thing. We've been able to do that for a while. It's not a standard clinical test. It's used more in research. But interleukin-6 is what we call a cytokine or a chemokine. These are chemicals released by the white blood cells, and they help you fight infection. They help you fight viruses, they help you fight cancers, they help you heal, and so forth. They are inflammatory markers. Interleukin-6 is especially potent because when interleukin-6 is released by white blood cells, it activates other white blood cells and results in the release of other chemical enhancers of the immune system. Okay? So it raises inflammation. When interleukin-6 goes up, inflammation goes up. And what we know from a number of studies now is that when people are experiencing negative emotion, their interleukin-6 levels go whoop right away. So for as long as you are stressed out, your interleukin-6 levels are elevated. Now we know that it's not just interleukin-6, it's all those other pro-inflammatory cytokines are elevated when we're stressed out. Now, what's the problem with that? Well, interleukin-6 is secreted in response to stress, as I mentioned. And one thing that we didn't know before is that the autonomic nervous system regulates your immune system. What does that mean? Okay, your autonomic nervous system consists of the sympathetic nervous system and the parasympathetic nervous system. Now, the sympathetic nervous system you may know as the fight or flight response. So when you're in a situation that is particularly scary, where you need to run or fight, your sympathetic nervous system is activated. What does the sympathetic nervous system do? When it's activated, it results in the release of cortisol, and as cortisol levels go up and up, they can activate the release of adrenaline. So cortisol and adrenaline make you or contribute to your anxious, excited state. Cortisol, adrenaline, okay? So it causes your blood sugar to go up, it causes your body to be ready to run and to fight, and lots of adrenaline, just excitatory stuff, right? And so that's the sympathetic nervous system. The sympathetic nervous system also activates or hyperactivates your immune system. Think about the old days. Think about 100 years ago or 1,000 years ago. If your fight or flight system came on, there was a reason. Usually you were being chased by like a wild animal, or perhaps you are being chased by a band of other people who are out to get you with their clubs. And so your sympathetic nervous system was activated so you could run and get out of there. And you want your blood sugar to be high when that happens because you're going to need that sugar to make energy for your muscles so you can move and fight and move, okay, and get out of there. All right. Now, also, your body, when the sympathetic nervous system is activated, your body will prepared to be bitten. And so you want to do wound healing because you could be bitten, you could be cut. Swords and arrows do that sort of thing. And so you got to prepare your body to heal. And so inflammation goes up to heal. Inflammation also goes up to fight infection. What if you get bit by a tiger or a wolf, okay, or a person? You're going to get infected, okay, or you just get cut from from thorns, and then the wound gets infected from the bacteria on your skin. You need to fight off that infection. So when your sympathetic nervous system was activated, it would prepare you for fight and flight and infection. And so your immune system was cranked up. So your white blood cells would go into action when your sympathetic nervous system is activated, so that they start releasing these chemical signals, these cytokines, tumor necrosis factor alpha, interleukin 1 beta, interleukin 6, interleukin 8, interleukin 10. All these interleukins go up, as well as not just interleukins, but interferon and other acute phase proteins. So your immune system is very much heightened, right, in response to the sympathetic nervous system. Now, to be honest and to be complete, sympathetic nervous system actually has the ability to activate the immune system and to kind of suppress the immune system, but mostly activate. All right. Now, what happens when you found a safe place? You climb back up that tree, you're back at your house, the tiger is long gone, and you're able to now relax, sit down, tend your wounds, pain is going down. Okay, now your parasympathetic nervous system kicks in. Parasympathetic nervous system helps you calm down. Okay, it helps get you ready to eat stuff, so you can kind of give your body the protein and nutrients that it needs for healing or rest and chill out. That's your parasympathetic nervous system. Your parasympathetic nervous system also calms the inflammatory response. Okay, your parasympathetic nervous system is mediated throughout your body mostly by the vagus nerve, cranial nerve 10. And so when you're chilling out, when you're relaxing, and the parasympathetic nervous system is active, one of the things that happens is your vagus nerve goes from your brainstem, and it connects to various parts of your body that are rich in immune cells. So to your spleen, your liver, your heart, your gastrointestinal tract, and so forth. And what happens by terminating on areas of your body that are rich in immune cells, it releases acetylcholine. That's what the parasympathetic, or the cranial nerve 10, the nerve endings release acetylcholine, which hits all of these white blood cells, and it binds to what we call nicotinic cholinergic receptors. And so when it releases acetylcholine, it quiets the immune cells down. And so instead of being overly active and secreting all of these hyper-inflammatory chemicals like interleukin 6, it quiets the release of these down, so they become more dormant, and it has an anti-inflammatory effect. It's called the parasympathetic anti-inflammatory pathway. Okay? So sympathetic increases inflammation, parasympathetic decreases inflammation. And you want these balanced so that you are able to meet your challenges and fight infection and repair tissue when necessary, but when it's time to relax, you're able to turn that thing off so that it's not overactive. What happens if you have an overactive immune response? What happens if it's too active? Well, just take a look at autoimmune diseases. There are a lot of autoimmune diseases, okay? There's lupus, there's multiple sclerosis, there's fibromyalgia, there's inflammatory bowel disease like Crohn's disease, ulcerative colitis. You got all kinds of things, Hashimoto's thyroiditis. There's lots of autoimmune disorders, and we've known for years that if you have a mood disorder, especially if you got lots of anxiety, your risk for autoimmune disorders is higher. Now that you understand the parasympathetic anti-inflammatory pathway, you realize that the reason that people who are stressed out and have lots of anxiety, the reason they have increased incidence of autoimmune disorders is because their sympathetic nervous system remains activated way too often. And as long as that is being very active, your parasympathetic nervous system is kind of off here. And so you don't get that anti-inflammatory effect from the parasympathetic, and so it's not balanced, and so your sympathetic nervous system is overly active, it's running, and it gives rise to autoimmune disorders, okay? Now, in addition, the inflammation is very damaging because that excessive inflammation damages the endothelial cells. The endothelial cells line your blood vessels, and that excess inflammation, it's like little nicks little nicks in the inner membrane of your blood vessels, and those start clot formation. The inflammation is the first step in forming a thrombus or a blood clot in your blood vessels. Now, why is that significant? Well, think about what I've just said here. If you put it together, the more stressed you are, the more depressed you are, the higher the inflammation. The higher the inflammation, the more damage to your blood vessels. The more damaged your blood vessels are, the more that you're progressively causing hardening of your arteries. You are causing clot formation to happen in your vasculature, in your blood vessels. So your risk of a future heart attack, from coronary artery disease, your risk of peripheral vascular disease, your risk of stroke, these are all increasingly elevated with stress because of these physical effects of depression and anxiety on your body. Okay? So now let's go through some of the specifics. That was the overall, that was the big view. Now, if you have stress and obesity is also present, then it's even much worse, because obesity itself also raises inflammation throughout your body. So if you have obesity and you are stressed out, then these inflammatory markers are much, much higher. You've got a double whammy there. Okay? There are markers of inflammation that I mentioned, and I've listed a few of the specific ones that are elevated in response to stress: acute phase protein, C-reactive protein, fibrinogen, immunoglobulins, adhesion molecules, and cytokines. Now, some of these are specific markers of just gross inflammation, and others are markers of endothelial cell damage or blood vessel damage that leads to premature clotting. Okay? Major depressive disorder, by virtue of its pro-inflammatory status, leads to endothelial dysfunction, which ultimately leads to hardening of the arteries and premature damage, such as, coronary artery disease and cerebral vascular disease, risk of strokes, and so forth. And obviously death. The higher the inflammation, the more inflammation going on, the greater your cardiovascular risk, the greater likelihood that you're going to have a stroke within the next 10 to 12 years. In a very stressed, depressed individual, if you were to monitor their blood, we would see elevations in these factors that are indicative of increased inflammation, such as those that I've already discussed. But in addition to markers of generalized inflammation, there are specific markers that tell us that there is damage to the blood vessel cells, the endothelium. There are a number of circulating biomarkers of endothelial damage that can be seen in individuals with elevated depression and anxiety. These include your adhesion molecules, ICAM1, VCAM1, von Willebrand's factor, E-selectin, P-selectin, endothelin-1, and something called ADMA. Okay? These are all elevated in stressed individuals. And again, it's like if you imagine these as the components of the endothelial cell, and when those cells are stressed out and not doing well, they're like bleeding molecules that are supposed to be inside the cell, but they're leaking out of the cell because the cell's damaged. And stress caused the damage. You see these markers in individuals with cardiovascular disease. So yeah, clearly somebody who you do a stress test on them, you take a look, you do the angiography, and you can see the clots in their system. Yeah, they've got cardiovascular disease, and you can see it physically, and you can measure these things in their blood. But in individuals who haven't had a heart attack yet, if they've had significant mood disturbances, anxiety and depression, these markers of blood vessel cell damage are also elevated. Now, Dew and colleagues, Dew was the guy's name, the researcher, because that's confusing if you don't know, because, anyway, some guy named Dew, he and his colleagues discovered that when hopelessness was a significant factor in one's depression, then in their blood, the endothelial markers, I think it was E-selectin, E-selectin and ICAM1 were elevated in their blood, specifically when hopelessness was a major part of their depressive episode. So when somebody feels hopeless and they have heartache, their blood vessels are literally aching. Literally, there is like damage to their blood vessels, which are part of your heart, you know, that's your cardiovascular system. It actually is aching and is physically being damaged when hopelessness is a part of your depressive episode. What we've learned in the last 10 or so years is that inflammation and damage to your endothelial cells are common when people have psychiatric conditions such as depression and anxiety. So independent of lifestyle factors, independent of sex and weight and all that other stuff, if a person is experiencing significant emotional stress, then it affects it enhances inflammation such that you can measure the inflammatory markers in your blood, and there are also signs of endothelial damage are manifested in their blood. Depressive symptoms are associated with elevated inflammation, endothelial dysfunction, and myocardial strain. Solano and Associates discovered that not only do people who've had a heart attack and experience something called post-acute coronary syndrome, the more depressed you are, the more inflammation, the more endothelial dysfunction, and the greater the myocardial strain. By contrast, positive emotions such as optimism and gratitude had the opposite effect. It was associated with better endothelial function. It can actually reduce some of the damage that the negative emotion causes. So what happens though if you remain in a chronically depressed, anxious state? Well, this damage, this inflammation, this blood vessel damage continues to accrue, and the worse your mood disorder, the worse your depression, the stiffer your arteries become. Okay, you can measure arterial stiffness, or not you, because you might not be a cardiologist. If you're a cardiologist, you can measure arterial stiffness by measure something called pulse wave velocity. Pulse wave velocity. The faster the pulse wave velocity, the harder your arteries. Think of it as your arteries being very stiff. And so if you stretch a stiff artery, when it bounces back, it's going to go whoosh. And so that's kind of thing. When your heart beats and it pushes a pulse of blood through, and those walls, if they're really stiff, then they might expand a little bit, but they're going to come back quick because they're not very pliable, right? Okay? So your pulse wave is going to be higher. So the stiffer your artery, the faster the pulse wave. The lower the pulse wave, the more pliant your arteries are. Okay? Young people have lower pulse waves because their blood vessels aren't as stiff. They're more pliant. Okay? Now it turns out that not only do your arteries get stiffer with age, and so your pulse wave gets bigger as you get older, if there is mood disturbance, if there is anxiety, if there is depression, then your pulse wave velocities go up as an independent factor. So disturbed mood, the longer you remain in a depressed or anxious state, the stiffer your arteries become. Now that doesn't go away. I mean, that's once they achieve a certain level of hardness, you're not going to soften those up later. That's usually a result of months or years of depressed mood, and that increased pulse wave velocity, that's how hard they are, okay? And so that's an independent marker of cardiovascular risk. You know, kind of the bad news there is that if you look at your pulse wave velocity, and if it's been increased because of chronic depression or severe anxiety, again, I said that's not reversible. And it doesn't matter whether you're now being treated with antidepressants or therapy or not. Even if your depression goes away, you're still left with these hardened arteries. That's why I hope, for those that you are listening, I hope that you take that seriously and get treated so that you don't remain in a stress state for a prolonged period, so that your arteries don't harden to that irreversible degree. This is a picture of that cholinergic anti-inflammatory pathway that I talked to you about earlier, and you noticed your vagus nerve, the afferent vagal neuron, which that's the part of the neuron, that's the part of the nerve that goes from the brain to the rest of your body. And as I mentioned, it impinges on your immune cell, that gray cell at the bottom of your screen. That's your immune cell, like your macrophage, your monocyte there. And so the vagus nerve, when stimulated, because of the parasympathetic nervous system, it releases acetylcholine. Acetylcholine binds to those nicotinic cholinergic receptors, and it turns down the immune cell. And so it reduces the rate of release of cytokines, so that your interleukins, your tumor necrosis factor alpha, interferons, those guys stop being released so much. It gets quieted down by that parasympathetic nervous system. And this slide shows you the same thing, but it shows you the various organs that the parasympathetic nerve terminates on. And in these organs, you have lots of immune cells. Lots of immune cells in your gut, your liver, the spleen, and so forth. And so by releasing acetylcholine on these immune-rich targets, you quiet the immune system down. And so even though this is the sympathetic nervous system, when activated, gets all these cells stimulated, when your parasympathetic comes on, as when you're relaxed, when you're chilled, when you're no longer stressed out, it quiets that down to help prevent excessive inflammation and autoimmune diseases and damage to your endothelium and so forth. Okay? So psychophysiological consequences of stress include increased sympathetic release, the adrenal hyperactivity, decrease in vagal tone, increase in plasma catecholamines, vasoconstriction, elevated heart rate, platelet activation, which makes your blood more sticky, more likely to make a clot. Now, in addition to this, I got some more bad news, and that is this. Heart rate variability is a measure of how adaptable your heart rate is to various changes and so forth. If you have high heart rate variability, the likelihood of having a dangerous arrhythmia such as ventricular fibrillation is much less. Low heart rate variability is kind of bad, because if you've had a heart attack or a major heart event, the likelihood of you having another one and dying and going in through a dangerous arrhythmia is significantly higher with low heart rate variability. Now, why is that important to know? Well, in healthy, non-stressed individuals, you have more heart rate variability. And so if you were to have a heart attack, the likelihood of you surviving is quite higher. However, if you're stressed out, stress by itself reduces heart rate variability substantially. So if you've been chronically stressed or you fall into a depression after a heart attack, you are more likely to be dead soon thereafter, because the likelihood of a dangerous arrhythmia developing is higher with low heart rate variability. So again, untreated depression, runaway stress increases your risk of cardiovascular death by another mechanism, independent of the mechanisms that we talked about earlier. Okay? Oh, they are kind of related, so I shouldn't say independent, but it's another cardiovascular risk factor there. So basically, just to summarize what I've just been saying here, is that stress, anxiety, depression, letting it go and just wallowing in it, understand that this is like poison. And the longer you allow yourself to remain in this state, it's like sipping poison. Every minute that goes by that you exist in that state is another sip, and another sip, and another sip. Your risk of autoimmune disorders, psoriasis, eczema, seborrhea, Hashimoto's thyroiditis, rheumatoid arthritis, sarcoidosis, Crohn's disease, ulcerative colitis, asthma, and so forth. Your risk of autoimmune disorders is significantly higher the longer we allow ourselves to be exposed to that stress. The risk of cardiovascular disease, of peripheral vascular disease, coronary artery disease, stroke, accelerated aging, these are all a consequence of the toxins that our body is exposed to as we remain in a distressed state. So, the point is, if serenity can be achieved by whatever means, whether it's through therapy, through spiritual maturity, through medication, through all of the above, you need to think about pursuing it, to allow this to continue, to exist in this chronically stressed, distressed, anxious, miserable state. We say, oh, it's killing me. It feels horrible. I'm heartsick. Well, what we've come to understand in the last 10 years is that's literally true. Literally, it's killing our heart, it's killing our skin, it's killing our blood vessels, it's killing us. The longer we remain in a distressed state, devoid of peace, devoid of serenity, we are dying. We are aging at an accelerated rate, and we are coming upon our own demise rapidly. So, yeah, treatment is optional. But to choose not to treat is, in a very real way, to choose death. So I hope I gave you something to think about. I didn't mean to actually scare you too much, but I hope to scare you enough for you to take this seriously and to not accept this as natural and okay. If there's anything you can do about it, and there are many things you can do about it, then I suggest that you move. Thanks for watching.